Good afternoon to our military families. Whether you're here in person or watching on Facebook, welcome to our San Antonio Market Information Forum for Parents of Exceptional Children. Distinguished panel members, we appreciate you taking the time to be here. Thank you also to all of our military and community partners here in the Medical Mall for sharing important information with our families. Over the next hour, our panel of experts will share updates and information, followed by a question and answer session. We will take questions from our audience here as well as from our viewers on Facebook, who are encouraged to ask questions in the comments section. We also received some pre-submitted questions from families, and we'll share those as well. Without further ado, I will turn it over to our panel for introductions.
Hi, good evening. I'm Major Sean Mayer. I'm a developmental and behavioral pediatrician, both here at Brooke Army Medical Center and Wilford Hall Ambulatory Surgical Center.
Hi, Dr. Kristen Fleming. I'm also a developmental pediatrician at Wilford Hall, and we also work here at BAMC as well.
Colonel Steve Spencer, I'm Chief of Pediatrics at BAMC.
Sally Gonzalez, Efmp Family Support Coordinator here at Fort Sam Houston.
Thank you so much. Again, we really appreciate you being here and taking your time out. So to start, I'm just going to open it up to the panel if they have any updates or information they'd like to pass on to our audience here and watching online.
Yeah, thank you very much for giving us your time this evening. Dr. Fleming and I have been able to put some of our thoughts together to provide information to people that are here and people that are watching, ways to support children who have special health care needs. I want to say thank you to some of the organizations that have come and set up tables here, so Efmp, Special Reach, Alamo Area Council of Governments, Clarity, and so thank you for coming and supporting our families also. So April is the month of the military child, and our focus is making sure that we're providing crucial care to children and families who need that medical readiness support. And so with this in mind, one of the focuses of some of the things we're talking about, and hopefully ways that we can answer questions, is to make sure that families are aware of the different avenues to receive support for their families and their children. Certainly, some of that comes from developmental and behavioral pediatrics. So our specialty care focuses on supporting families who have concerns about their children when it comes to thinking, learning, acting, speaking, moving, and interacting. And our job, our expertise, is to provide a lot of time and care managing and going through that complex information and making sure that families have direction on how to find the supports that they need for their children. We are not the only gateway to get that information. And so outside of our specialty clinic, our primary care providers at Wilford Hall, at Brooke Army Medical Center, and our outlying clinics are all trained pediatricians or family medicine providers who have skills and abilities to address very common issues that come up in pediatric care. They're able to have time and accessibility to families much sooner and more rapid than maybe a specialist office can, and can follow up on issues over time in a way that is much more nuanced and much more flexible than we have in much longer appointments. And so we've spent a lot of time over years, but especially in the last few months, trying to prepare and build up the skills of our general pediatricians and primary care providers to make sure that we're extending the skill set that we've got to be able to reach down to families so that we don't have to be the only gateway for families to receive care. Beyond our primary care clinics, there are agencies and therapy services in communities between early childhood intervention for children that are under 36 months old, school support programs for children starting at 3 years old through 5 years old in developmental preschool programs with special education, and then community partner organizations, therapy services for pediatric habilitative services, speech, occupational, physical therapy, ABA therapy, as well as community partner organizations like some of the folks that we have here today that don't need any medical provider to give information to families. We want to empower families to find those resources themselves. And so those are some of the things that I'm hoping that as we have discussion, we can capitalize and share that information with families to democratize that so that parents, caregivers, patients themselves are their best advocates.
Thank you so much. We really appreciate that. And thank you again. I see there's quite a few people watching online, so we welcome you as well as the wonderful people here in the room. We will now begin the question and answer portion of the forum. If you would like to ask a question, please raise your hand or stand up, and we will pass a microphone to you, which will ensure our online viewers can also hear your question. Please keep in mind that our panel will be able to answer general questions. If you have more specific individual concerns, please stay after the forum to talk to a panel member one-on-one. This will protect your privacy and also ensure we have time to answer everyone's questions. Our online viewers are invited to post questions in the comments section on Facebook. So having said that, who would like to ask the first question? If there are no immediate questions from online or in the audience, we do have some pre-submitted questions we can start with. The first pre-submitted question: JBSA is a pre-approved base, and families in need of developmental pediatrics don't have the adequate access to care that they need. What is the plan moving forward?
So I can actually answer that once again. Hi, Dr. Fleming. Part of it, I think that question has two parts to it. The one is about kind of the adequate access to care, and the other thing is kind of what are we doing forward. So speaking specifically to the adequate access to care, currently in the market, the wait list is probably around 12 months. So for us, historically, we've usually had around like 3-month wait lists. So when we say adequate, it's actually much better than the market. And I don't mean to minimize that 3 to 4 months, because for families, I'm sure that's really stressful. But at the same time, it's not 12 months. So when we talk about adequate access to care, I know a lot of parents might think, I want to call, how quickly can I get in? And I think that also kind of depends on what you want. If it's a new consult, that's a different question than I need a follow-up. And if you need a follow-up, do you need to be seen in person or can you do it virtual? So I think that those are kind of different questions. We are working on kind of the new evaluation, so families who are in the beginning process looking for direction on how do I help my child. That's a lot of what we have been focusing on right now and kind of adding those services. And I can talk about in a second, but the patients that we're kind of following up, one of the main plans is kind of to leverage your pediatric physician. So I would talk to whoever your pediatrician is. If you have concerns during this little underlap that we have, you can always have them reach out to somebody who's developmental pediatrics. They can talk to a PCM, and we can try to find ways to advocate for you through your PCM. For the new referrals, we have a few things in the work that we actually been working on to try to get patients in faster. One new program that we're starting is the Developmental Behavioral Extender Program. So there are actually 8 pediatricians in the local area at the multiple bases in Joint Base San Antonio, where we have trained them, and they've gone through a specific course to do a validated assessment tool for kids 18 months to 4 years of age, where there are concerns for autism. So for them, that is actually going to be a huge help to families with young children, where they're going kind of, where's that next direction? So we've worked on mobilizing that resource regarding kind of how do we get those evaluations in. And so for families also, we know some families have looked at, for those new referrals that have come in, what happens in this gap of time. And for those families, I would have them speak to their pediatrician. If you had a referral placed in the past few months and it was deferred to the network and you would really like to be seen in the MTF, we would love to see you. So what I recommend is that you speak to your PCM probably in August, September, and then that way see if they can put in another referral, and that might help to put you guys back on there on our list of the wait list that hopefully we can create once the new providers come.
Can I comment on a couple of things?
Yeah, please.
So across the DoD, the Army has roughly 10 developmental and behavioral pediatricians. The Air Force has roughly 10 developmental and behavioral pediatricians to serve all Army and Air Force bases. San Antonio has a market of about 35,000 children for 2 to 4 developmental pediatricians to be here. So this does not at all, this is not an effort to try to make light of the fact that for your child's the one that matters. And is the one that matters to us too. Like, we want to see patients, we want to care for your children. This particular summer of 22, has seen a number of changes, a rollout of a new electronic medical record system, COVID changes that have caused demand and decrease of manning and personnel, and in addition to a typical cycle of separation and PCS and gaining new providers to providers who have separated. And so our adjustment has needed to be pretty sudden, and we're trying to make sure that we are balancing new consults, new access to patients who have been here in San Antonio for a long time and have seen us many times, and trying to balance those needs. So we want to make sure that we're making those resources as equitable as possible right now, with the anticipation that down the road there's going to be further adjustment. When we have more resources, more providers, more training, those things will of course adjust and right size.
Yeah, every summer the MTFs go through what we call the summer underlap. As people PCS or retire or go ETS and separate, they leave and they've got their leave time that they get, their movers come, etc. Meanwhile, the new people aren't here yet. And so typically that's about a 6-week, 8-week underlap over the summer where everybody's running a little short. If people get out of the military, you add a couple of months to that because they have to do all their separation. And so we had 2 people actually separate from the military here this time. The new people will be here in about July, and it'll take them a few weeks to get moved in, get credentialed, and then get set up to seeing patients. So a summer underlap is nothing new for us. We have summer underlaps across the facility and all sorts of specialties every year. It just hit developmental pediatrics rather hard this year because of the unexpected loss of 2 people ETSing.
And so the core message should be like, we are not going away. I think that is a message that some families have heard and have voiced to us concerned that there's zero developmental pediatric access here, and that's not true. It is certainly thinner than it had been, and that thinness is going to be temporary with our full anticipation that it will be as robust as it has been in the past.
Thank you very much. Excellent. Marjorie has a question online. I'm going to ask her a question, then I'll turn it over to the room, see if there's any questions in the room. I think you covered it for the most part. Marjorie said they're having issues finding developmental pediatricians, but also mentions having issues getting their son into ABA therapy. He's 16, he was 16 and is currently 17, and it's been difficult working through the process. Is there any part of that you want to address, or do you feel like you covered that?
I can talk about ABA in particular.
For adolescent? Mm-hmm.
Yeah, so for ABA therapy, so the TRICARE Comprehensive Autism Care Demonstration has had revisions in the last year that have been frustrating, and frustrating for many families, and have required lots of clarification for providers to make sure that we are offering good, high-quality information for families, and we're trying to decrease as many barriers as possible. Some of those barriers are things that we are able to assist with, making sure that referrals are placed in a timely way, making sure that paperwork and administrative issues from a diagnostic standpoint are done efficiently. Some of those barriers exist in the community with ABA agencies and their contractability with TRICARE and how those services are being reimbursed. And those are things that unfortunately are beyond my scope as a provider to understand. So I guess my encouragement would be that we understand that there are going to be some ABA providers in the community that are easier levers to pull, so to speak, like just because we know and have personal contacts with people, that we have ways to try to make connections and make contacts and try to, for this particular family, grease those wheels where we can. And so I guess my encouragement would be for this particular family, or for any family that's running into these chronic barriers where it is just hard to figure out the best way to move many moving pieces, starting with a conversation with a primary care doctor. All the primary care doctors can reflex and contact one of us. We can funnel this up so that way if there are specific barriers that seem quite overwhelming for an individual family or an individual patient, by our collective ability, we're able to work those things out.
I would agree. I think utilizing your primary care physician can be really helpful for families. Calling, speaking to one of their nurses. I feel like a lot of families, a lot of what we hear is they feel like they're going through this struggle kind of alone, and you're not alone. You have a whole team there that wants to help you. So I would make sure, and I would encourage everybody, if you're having concerns with access, talk to your PCM and their office and see if there's anything that they can do to help you, because sometimes it's a piece of paperwork that's missing that you just didn't know, or it is here's a list of local ABAs that can help with adolescents. So we do have those things available, and it's not just available to us. All of the primary care physicians, whether family health or pediatrics, can access this information, so they might have things so that you don't feel as much on your own, because you're not on your own.
Thank you. I just wanted to open it up for questions if there's any in the room. Okay, we have a question back here.
What programs do they have for autistic kids over the age of 4?
Sir, can you repeat your question to the microphone?
What programs do y'all have for kids over the age of 4 for autism?
Over the age of 4. So the question was, just to repeat again, what are the programs that exist for children over the age of 4 years old for autism? So I'll speak broadly about a couple of different things. So autism spectrum disorder has many facets of communication and behavior issues that often require support, and so those supports exist in multiple avenues. So I think one of the things that we as developmental pediatricians reflexively think about, because it has the most evidence behind, is an intensive behavioral intervention called applied behavior analysis, a intensive therapy that's typically offered in the community or in a natural setting in your home. So that's one avenue to receive focused behavior. Other avenues and support programs include early developmental preschool special education in a public school system that focuses on community participation, interaction with peers, following instructions from folks who are not the primary care providers, early school-focused and educationally focused speech and occupational therapy. Outside of the school setting, we think about community provided speech therapy, occupational therapy, physical therapy. Beyond that, we think about family support, so family, parent, sibling support. Beyond that, we think about community participation in things that are less formal therapies and more community participation, things like sports and rec programs, camp programs, social outings. I want to make sure that I'm addressing maybe the focused question if those things did not address that. And so
I think Ms. Gonzalez can contribute as well.
Right, thank you. And I'm Sally Gonzalez with Efmp Family Support, and our role is to assist families connect with local resources. And so the community partners that we have lists of community partners, definitely autism support groups for the kids with autism, and also family, their siblings, and parent support groups. So connect with Efmp Family Support. And we're located within the military and family readiness centers at each of the 3 locations.
That answer the question? Just wanted to follow up with you, sir. So I think that is a good point. There's a lot of different avenues. So your primary care physician, the schools after the age of 3 years of age, they actually may qualify for a preschool placement within the school. And so usually for that is calling your school district. No?
The way they do their testing at school is totally different than what a doctor. So they take they don't take the doctor's consideration. So even though my son can do 2 + 2 in the school setting, that's not considered autistic. So just, that's why we ran into a big wall, especially at his age, at trying to get him the support we need. I mean, we got him into ABA, but it was difficult. We got him into OT, which is hard because it's hard to find an OT in speech. So I mean, we're running into a big wall and and the school won't even diagnose him with autism, and it's really been hard to get him the right help.
Yeah. That makes, absolutely. So the school systems and the medical system are absolutely separate.
Attention in the hospital.
So I think, I don't know if it's going to capture that.
Neurology on call.
Can I doctor? So I think that is definitely something that we hear from families, is that it can be frustrating that you kind of feel like you're doing it twice and you feel like you make progress and then you stop in one area. So it's very much that little bit of confusion. So a lot of families have kind of felt that. So I think specifically it is separate. I can write a letter and they don't have to listen to me. So you as the parent have much more power than I do, but we do want to help advocate. There are some avenues within the community as well that can help with advocates. Was your concern mainly the school or getting a diagnosis or therapies? Or do you want me to talk about? It's more than therapy. Does the EFMP support groups?
Yeah, it would be like the support groups and community stuff and stuff like that. That's where speech and then stuff like that. Because, I mean, the way they have it set up at school is they only say he needs like an hour of speech every once a month, which we know with the kid that he's off the spectrum when it comes to autism. So it doesn't cut it I've even hired an advocate, and the school doesn't, they don't agree with what we say as parents. So even though it seems like we have more power, we really don't. It's like...
They look at educational, they look at educational goals, and you're going life.
Yeah.
So that's very common. So what we can always do is we can share with the public affairs team our list of ABA and speech therapy that we have kind of internally created. Would that be something that would be helpful? Yeah, absolutely. Well, we can make sure we send that. It's our own internal list we have with ABA companies, kind of what ages they see this. So this might be helpful with the first question as well that came online of the 16-year-old. There are certain ones that actually work with adolescents. So we can absolutely make that resource available to you guys. I think if we already did that hard work and compiled a beautiful list for you, maybe going out and advocating for yourself. And I appreciate you recognizing this is not what's best for him. We need something else. And that's sometimes a hard thing to do. So if we can definitely give you those resources for what else is out there for those specific therapies. So we'll make sure we make that available, sir. Thank you.
Thank you. Thank you so much. Appreciate that. We'll be happy to push out any list of resources. I wanted to just ask a couple of the questions for our folks watching patiently on Facebook. They've been awesome as our people in person. Mandy asks, can a list of organizations and contact information for those who are present at the event be posted online for those of us who couldn't be there in person? And I'll answer that, yes, we can absolutely do that. We'll make sure that we provide a list of the organizations and contact info. And once again, we appreciate everybody for being here. Caitlin asks, as a retired military member, some of our services were removed because we no longer receive ECHO.
Mm-hmm.
What can be done to alleviate the sudden burden of losing home health nurses or equipment needs?
So the extended care health option is a supplemental TRICARE program that provides access to some of those things that are not covered typically by TRICARE benefits. And so outside of the ECHO program for retiree families, some of the resources that families have found helpful are through things like enrolling in Medicaid and supplemental security income for children and young adults who have intellectual and developmental disabilities.
I'd like to also add, as EFMP Family Support, we work closely with our retirees as well to help connect them to these local resources. We have direct contacts at Alamo Area Council of Governments that kind of help us fast track some of our military families. And so, again, reach out to us and let us help you in this case management to get you to the resource you're looking for.
One of the really tricky things with families who are transitioning from active duty to retire status, or children that are transitioning from childhood pediatric focused care into adult care, is trying to figure out where services are available, because things really become quite fractured. One fantastic organization in town is called the ARC, ARC, and so that is a national advocacy organization that has state chapters, and then large cities have chapters too. And so the ARC of San Antonio specifically focuses on young adults with intellectual and developmental disabilities to specifically answer some of these questions. There are providers in San Antonio who offer respite care and home nursing and transportation assistance and housing assistance. The difference is that ECHO previously had covered some of those things from a financial standpoint for active duty members. And so once that benefit goes away, then for a lot of families who have children with disabilities, then that financial coverage often has to come through Medicaid.
Thank you very much. And I think we have another question in the room.
Hello. It was kind of just following up with getting services and therapy started. How do we protect ourselves from, let's say, we find an ABA provider, we go through the process. This process is taking 2 weeks to leave here, and then 3 weeks through TRICARE. By the time we start, all of a sudden there's not that available hours. There's not, so they'll only offer us, the doctor said, hey, I need 2 hours per week. That's what's recommended for my child. And they're like, well, I can only offer you 1. So I waited, or I ended up wasting a month and a half to get started with the services just for them not to be able to provide what I need. So then do I pick up and go with another service? And then I run into the same issue, and then I don't have my child in services for over 3 months. So what is there to kind of help us with that, especially when we're PCSing? Is there a way where your providers can network with providers from our other duty stations? Hey, this patient is coming, they're coming this time. Can we get them started on services? Because I got here December, my son didn't get services until maybe February, mid-February. And it was a process that when I left there, they're like, yes, we're going to communicate and have this ready for you. When I got here, I took 45 days of leave because I knew it would take about 30 days maybe to get him started. On top of my 45 days of leave, it took another 60 days to get my son into services. And it was because, he needs to be evaluated. I can't do it over the phone. Well, he just recently received his diagnosis. He's already been through the checklist to get him diagnosed. Why do I have to sit here and wait a month to get an appointment with your developmental pediatrician just for them to do the same thing again? And then to resubmit these referrals. So how do we move past that, or maybe a better solution so that we're not having our children out of services for over 3 to 4 months?
And that's a great question. I can take this one if everyone's okay with that. So I think there are a lot of families who kind of share that same thing. Once again, not minimizing your experience, but that is something that we have heard. So there are parts that we can control and parts that we can't. So if it's a new diagnosis, there is more Humana TRICARE paperwork. Once those are done, that can sometimes be like a one-time thing from your provider, where processing that can take a little bit of time. So that is something that on our end, after you do that, it is sometimes easier to transfer to a new place because all of that other stuff is in. So there are some families who have had difficulty with some services, and all we do is we have them contact their PCM, and then if they can find another one, you can actually let your PCM know, I want to go to this one, and they can put in that referral of ABA to the company of your choosing. And once again, we'll make available a list that you can kind of shop around. And I think some of it is we don't necessarily have, there are a lot of ABA companies. So the paper that we have is I think it's probably like 4 pages. It's in a landscape. So there are a lot of resources that you can do. We want to help in any way we can. I don't think that is something that we have considered, is actually kind of partnering with them, because once again, there are a lot of programs, but we can help you with how do you choose, and your PCM can help with how do you choose, which ones are we most familiar with. And once again, I think that list can maybe give you some more options to shop around, but it should be, there is always going to be that gap if you go from one to the next. So if you can continue with this one until you get that next one and then just kind of roll over, you can see if that might work. But I do recognize that getting those services started, they have to do the evaluation, they have to make this plan, and they have to come up with that. And you're like, I feel like we already did this. This feels very familiar. So each company kind of does their own way. So if they already have an evaluation process, sometimes they can use that at a new company.
May I add to this?
Yeah.
Please.
Also with EFMP Family Support, as you get ready for your next PCS, we can connect you with the EFMP Family Support Coordinator at your next duty station that also has access to these lists of ABA therapists. And so even though the EFMP coordinator can't authorize that you do that, you can start doing your research and talk to them about the relationships that they have in that new community. But it's always best, to check in with us, and so that we can do that warm handoff to your next duty station. And you already have that support system waiting for you on the other side.
PCSs are stressful. Period. And so if you have children who need to see lots of doctors and need to see lots of therapists, stress level gets higher and higher and higher. So in addition to some of the ideas that are here, for really any family, if you're anticipating a PCS coming up, you're already plugged into services, key questions to talk with your current therapy team, including ABA therapy, would be something along the lines of, we know we're moving from across the country. We know that we're going to be moving. We know that my child's toys are going to be in their box. Their bedroom is going to be changing. We're going to be in the car for 2 days. We need to specifically focus on what do I, mom and dad, what do I need to know about? What are some things that I can anticipate? I'm not an ABA therapist. I'm not a BCBA, but I am going to be with my kids for the next 60 days while we're trying to plug in services. And so what are some very crucial things that I can make sure that we're covering these gaps until I get those services plugged in? And I've heard positive feedback from families here. People come in and out of San Antonio pretty frequently. And so I've heard positive feedback from families that have specifically focused on that. And so the goals and objectives of ABA can change. They should be fluid. So they can be adaptive and make sure that families are set up for success as much as possible, knowing that it's all going to be up in the air. And we're trying to make the best out of the cards that have been dealt. So I feel you. It is hard. It's really hard.
Thank you. I just wanted to point out we have the information resources that our panel members put together in the back table in case you didn't get a copy of this with the gift bags. Thank you so much. I'm just going to I'm going to ask a Facebook question. I'll go back to the audience if they have another one. Jeremy asks, can families be seen and or referred out to Austin, Dallas, or Houston areas for care?
Which care? I think that is part of, I think that is, therapies, no, probably because they're more frequent. I'm assuming they might mean developmental behavioral pediatrics, so I'm going to move ahead with that. Yeah, physician care, developmental behavioral. So I'm going to move ahead with that if that person can comment, if that is not kind of your question. So I think that's a little bit harder because right now that is not kind of under our control. We defer to the network, and then it is all kind of determined by somebody else. So we mainly look at capacity and capability. So unfortunately, that's an external kind of decision about where those services are for developmental behavioral pediatrics. So once again, the wait list globally is around 12 months. So I know, I've heard of one in Austin that is like 9 to 12 months. So once again, our wait list is still shorter even with this gap. So they've had 2 developmental pediatrics before. I know right now we have a little bit of an excess, but they've had 2, and I think it sounds like the wait list has never exceeded 6 months. I think it was generally around 3 or 4 months. So if you're trying to get in faster by going somewhere else, I don't know if that's necessarily something that's going to happen, just because there is a shortage of developmental pediatricians nationwide. But I think that would kind of be working with CAMO, I believe, about where would they be resourced and where would they go. But once again, that is kind of outside of our realm.
Thank you so much. I just wanted to check to make sure there's not another question in the room. So Marjorie asks, is there a master list of developmental pediatricians off base that will accept TRICARE? I feel that information is not readily available. The current list we have that we receive from TRICARE does not work for 17-year-olds.
I'll try to answer that one. I'm not sure what list you have. If you go to TRICARE Online and search the Find a Physician part of the website, it will take you to a list of providers that accept TRICARE. And so if you search developmental behavioral pediatricians, there are, I think, currently either 4 or 5 in San Antonio that accept TRICARE. I don't know what age they cut off at, though. I don't know if you guys...
So my thoughts about that as an encouragement would be to think, instead of focusing just on I need a particular provider with a particular specialty, which maybe is necessary depending on whatever the issue is, thinking broadly, functionally, what are the things that I want my child's doctor to try to answer for me? What are the questions that I want them to answer? And so, especially for young kids, our bread and butter is young children with autism. We are really, really good at that. We're really good at doing a lot of other stuff too. And so our colleagues who also have training with children who have special healthcare needs, like pediatric and child psychologists, pediatric psychiatrists, child neurologists, geneticists, so those other providers can also help to answer some of those questions if that's more of the way to try to think about that. So you are right, there might be providers who have age cutoff criteria. And if that's the truth of it, which I don't know those things, then trying to think outside of that box and try to answer that more functional question.
I believe we have a comment from the audience.
Yes. Hi, this is Maria Guerrero. I'm the Chief of Patient Experience. In our office, we have the health benefits advisors for TRICARE, so you may call them at 916-3786. And they will answer and assist you to find providers out in the network as well. Or call our office at 916-233-30. We will assist you as well. Thank you.
Thank you, Maria, and I believe she posted that on Facebook. So if you're watching on Facebook, you can view that.
And that's a number that families can call directly. Wonderful.
Thank you so much. Any other questions from within the room? Okay. I think we have another comment from the audience.
Good evening, everyone. My name is Adrian Beard. I am one of the Efmp Family Support Coordinators at JBSA Lackland. There's also another resource for families that you may not be aware of. If you guys are on Efmp, you can also take advantage of medical case management. And they can also liaise between your developmental peds and that weight. They can assist you with anything that you have issues with. So that's what we like to refer our families to as well. And it's just something that hadn't been mentioned yet. I just want to make sure you guys were aware. Thank you.
Thank you very much. Appreciate that. I'm going to turn to a Facebook question from Melissa. My concern is communication and coordination with other DoD entities. We're Air Force and know many families are being hit hard by the changes to the Air Force My Vector system. Families will be moving here based on historical information that there is robust developmental pediatrician availability. What communication is this panel having with DAF EFMP to prepare families who are approved to move and will have hurdles this summer?
So I may have to defer to Colonel Sessions because I don't know anything about the My Vector. As we stated earlier, this is an underlap. It's not going to be a complete lack of developmental. It's going to be several months of having a shortage where we will be thin, but we have people here. And then after the new providers arrive, it'll be back to business as usual.
And for families who are PCSing in, especially if they have as part of their EFMP medically necessary specialists that they see, if I was a family moving, I would want to establish care with my specialist as soon as I possibly can. The reality might be that that care doesn't happen immediately afterward. And we try to cater to that as much as possible. We try to meet family needs as much as possible. And so there may be families who arrive into San Antonio where they need to see their developmental pediatrician every 6 months or every year, and that can be at a time when services are more robust. But I'm not... Go ahead. Yeah.
Good evening. Good evening. I'm Colonel Cecilia Sessions, one of the chief medical officers or chiefs of the medical staff for the 59th Medical Wing. And one of my primary responsibilities is managing the inbound applications in MyVector, which is an Air Force Personnel Center electronic health record that allows us to review applications in real time. That's why I'm here, because I've been working with the doctors that you see on this panel to make sure that we're providing accurate and up-to-date information about our capacity as well as the capability, which is enduring at this location. That's actually a requirement. We've committed to that as a service and as a San Antonio market. So there are still human eyes that review every MyVector application that comes here. I am one set of those human eyes. We have at least 4 other chiefs of the medical staff on the Air Force side that also review inbound applications in real time to make sure that we're providing accurate and up-to-date information by coordinating with our developmental peds partners, by, Dr. Spencer and I have had a lot of conversations as old pediatricians together. So we are looking at those applications and we're making sure that that information is accurate. And I will be available afterwards for questions about that particular system.
To add that currently, I know there was some talk of us going from 4 providers down to 2. This was a lot of people. So generally at Wolford Hall and here at BAMC, there is 1 spot for 1 developmental pediatrician. This has been robust. There have been extra providers than have been allotted. So even Dr. Mayer and I, we share the same job title because there are not 2 spots. So the 2, though we are going from 4 to 2, it has historically been just kind of 2 here. So I don't know if that answers kind of that question for the robust of, I know families were concerned that we were going from 4 to 2. That once again, this is historically what there's always been 2. This was just kind of this weird moment where we had some extra ones, and we're going to kind of go back down to where we were. But we still will always have developmental pediatricians here.
Thank you very much. Is there any other questions from the room? There's no more from Facebook at the moment, but we welcome them to continue to post. But I do have a couple more pre-submitted questions that we can turn to. Someone asked, can you tell us a little bit more about the Efmp program and its various components?
Thank you. Efmp is comprised of 3 components. And those components are identification and enrollment, which are on the medical side, assignments and coordination, which would be with Human Resources Command for the Army and Air Force Personnel Center with the Air Force, and then with the Navy, it would be the detailers. And the information from identification and enrollment then goes to the assignments piece. And then the third component is Efmp family support. And there is, for this one program, those 3 components would be at different locations at your installation or your base, if you will. But family support is the piece where we really work with the families. And our, as I mentioned before, our mission is to support those families to connect to the local resources on base and off base. And we work very closely with the medical community. We work very closely with our the local community partners, such as the school liaison office, legal services, different nonprofit organizations. But we're also responsible for educating the community on the Efmp program. And so we host workshops throughout the year about understanding the Efmp program, or topics that are the needs of our community, and those are based on surveys that we take or customers that come in and what those numbers are. So we offer locally, we do classes like preparing your IEP or your 504 for the next school year. Autism 101, we have classes such as that, or preparing special needs trust, and we invite our legal services to teach those classes. But we also offer recreational and educational opportunities as well, so that we can, have that support system. We do awesome activities throughout the year, like taking our families out to Morgan's Wonderland or to museum, or we do some arts and craft activities throughout the year. We try to host adult activities where it's a kid-free zone and it's just our adults participating in things like that. We also run the respite care program, or I'm sorry, I used the wrong term, but we connect families with respite care. And then we host support groups throughout the year. But it's case management, if you will, non-medical case management, and we work closely with our families to connect them to many, many resources, some that you see here, others that are not here, like the Down Syndrome Association or the United Way, Any Baby Can, Early Childhood Intervention, the ARC. And we host big events too here at Joint Base San Antonio, like our Halloween Howl Down or our All Is Calm Christmas party. And so we just want to encourage our families to reach out to EFMP. If we don't have the service, we're going to do the research to help you find that. And one last piece to what I was discussing of our responsibilities is also to assist with priority housing for family members who need to get into housing quickly. So, thank you.
Thank you very much. Another pre-submitted question. How long will MHS Genesis impact appointments for care?
So I can answer that one. And the answer is it's not an MHS Genesis problem anymore. We've been back to 100% appointing in pediatrics for a while now. The issue is that we had 2 developmentalists who ETS'd and have already left. And until their replacements come this summer, that's what's affecting appointments. But as far as pediatrics is concerned, we're at 100%.
Thank you very much. Another pre-submitted question. I've noticed long delays in EFMP medically related emails for updates and enrollments. Can we improve this process?
Yeah, that one's mine too. This is a good one. Yeah, we're trying. We admit there's been problems, there's been delays. It's kind of been the perfect storm of several factors. We got the new electronic medical record Genesis, which really slowed things down, hit our access, had a steep learning curve. EFMP, though, also, Army EFMP got a new system called Web EFMP that's a very difficult system, had its own learning curve, and frankly is pretty slow, and is actually so bad they're going to replace it this fall. And then there's also a new overseas screening program that the Army has implemented that had new requirements, again, a learning curve. People have to be trained to do these properly. You can't just take any old nurse or physician and have them go work in EFMP and go through these packets, because you have to be trained, you have to be given access to the system, you have to have training on these electronic medical records. So we had that along with some vacancies in EFMP where we have some open hiring actions. And of course, in our system, that can take a while to get people in and get them trained up on the system. And then COVID. We had COVID come through and knock out some of our people. So when you only have a handful of trained people, it makes it difficult. And BAMC is not just taking care of BAMC patients. We are the regional EFMP. So we get all the packets from all the Army medical treatment facilities within our region for the final look. And so it was just this perfect storm of things that hit us all at once. And I know there's been frustration because people say, I've tried to call EFMP, or I went by EFMP and I couldn't get in. I actually did that. You can be mad at me because every time one of our people would be working on a packet, the phone would ring, or somebody would walk in and have a question. And with so many people being out because of COVID and things like that, they just couldn't get through any packets. So we said, lock it down, go to this web email system, and I just need you to crank out packets as fast as you can, because you're the only couple of people I have that can do this until we can get some relief. So we have some hiring actions coming. We took people and we trained them to the extent that we could to help process these packets. We stole doctors from other access to care, like we took pulmonologists and cardiologists and people like that and taught them how to do EFMP packets to try to get through this process as much as possible. But the backlog really is the administrative side, because only the administrators have this web EFMP access. With that being said, we're getting caught up. We've actually opened back up to limited hours on Tuesdays and Thursdays. We now have office hours where you can call or you can walk in, where previously we didn't have that. And so we're getting there. We're getting caught back up. But of course, it's the PCS season, so there's a lot of packets coming through and only a small handful of people to do them. But you know, we're doing our best. But yeah, it's been a problem, and we completely recognize that and knowing that.
Thank you very much, sir. So unless there's any other questions in the room or on Facebook, I'll ask the final pre-submitted question. There's a 3 to 4 month wait for care off post. So why are families sent off with no warning? Can they get some warning before they're referred out?
So that's a great question. So we have known about, at least I've known, that I'm going to PCS, and Dr. Mayer, he got the program director position for the residency probably like January. So we've been doing things behind the scenes to kind of mobilize it. That's where the extender program came in, to get those little kids in and evaluated for autism, and services started as soon as possible. He and I have also reached out to all of the PCMs to see if they could communicate with families that there would be some deferrals to the network. For us, we're not a PCMH, there are no patients assigned to us, we're just consultation. So we don't have a list. So most of the time, if you go to a primary care physician, if you have somebody here or there, you're gonna be what they call empaneled. So that means you are linked to a primary care physician. That does not happen in consultative services. So we don't have a list of anybody. And plus, it's also people who we have never seen, and then it's people that we don't see on a regular basis where we would not have had that chance to communicate. So we've tried to do that with the physicians to have them let you know that this was coming. So I apologize if that was not communicated to families, but we did kind of work internally to make sure that the providers knew, and we also sent out another email letting them know that if they put in a referral in the past few months and it was deferred to the network, that patients are welcome to come back to them whenever we resume. Once again, that might be around like August, September. And then they're more than willing to kind of put that back in, and then we can kind of run that through. So if you were deferred and you're worried about kind of going to the network, please come back. So that is something that we are communicating internally with our physicians and our primary care physicians at all of the different bases that we serve, to try to just let them know. So I apologize if the message didn't get to you guys, but we don't always have a clear-cut way. But we definitely have tried to make some strides to kind of fill the gap and find ways around it. So we've been working on that.
Thank you very much. We did get one more Facebook question, so this will be our final question. Thank you to Ginny for taking the time. Are any changes coming to the EFMP Respite Care Program? Many families have expressed frustration with the current system and not getting the information they need to be able to interview providers, delays, getting hours scheduled for care. Many families want to use the program, but it's getting a little frustrating.
I'm I'm going to assume that's an Air Force respite care program. Question. There are actually 3 different respite programs dependent on the branches. And so the explanation, the Air Force provides 40 hours of respite care, and the Navy does as well, and the Army offers 25 hours. The process to enroll in that program is different for each branch. And so I'm not familiar with the Air Force process. I am more familiar with the Army process.
We can speak to the Air Force process at least. So it's a form that is filled out, and it is in all the Air Force locations, and if your provider doesn't have it, we're more than happy to provide it, and then they just fill it out, and then you submit it. I don't know if this concern was at kind of the resourcing end of who is actually coming, and I'm not sure if that was the question.
Ginny, I asked her to clarify, but we can always get back to her after the fact, and we have a comment here.
Yes, so for the Air Force Respite Care Program, to my Facebook family, what has happened is we had a civilian service provider. That service contract was no longer renewed, and the Air Force Child and Youth Services Program took over the Air Force Respite Care Program. Through the transition, there's been a lot of glitches, new systems, a different way to pay providers, and it is making our families very frustrated. We refer all of our respite care to Child and Youth now because they are the program owner. But we know that you all are frustrated. Big Air Force knows that you all are frustrated, and they're working as diligently as they can to work through these issues. I recently went through a rapid improvement event at AFPC in the first week of this month, and respite care was one of the #1 priorities at said rapid improvement event. So trust me, your concerns are being heard. We know that you're frustrated, and we're working diligently, or I should say Child Youth Services is working diligently to resolve those problems.
If I can add as well to that, under the National Defense Authorization Act of 2021, it stipulates that the Efmp program be equal across the board. And so our up at the headquarters level reached down to Efmp to get Efmp family support to get information about this. And Joint Base San Antonio participated in a 2-year pilot program where we compared each of the systems, the Air Force, the Army, and the Navy system, and that went up. And so respite care, because of the Authorization Act, allows for the Efmp program to become across the board. But of course, it's going to take time, but please know that we report upwards, and they're aware of it. Thank you.
Thank you so much. And we'll follow up with Ginny and anybody else on Facebook that still has remaining questions, or the people here in the audience, if you'd like to stay and talk to our panel members or walk around the different booths. We'll also, like I mentioned, keep an eye on Facebook to answer some of your questions that may come in a little later. So that concludes the question and answer portion of our forum. A special thank you to our distinguished panel members for their knowledge and expertise. I'd also like to just give a little welcome to our BAMC commander, Colonel Beaver, and Command Sergeant Major Reynolds in our audience. And last but not least, to our incredible community resources and military resources that took the time to be here this evening. Thank you so much. Thank you again for everyone who attended and watched online. This concludes the forum. Have a wonderful evening.